Welcome to Promoting Healthy Communities Using Multi-Level Participatory Strategies. The ecological approach to community health promotion. Nurses have long recognized the importance of an emphasis on wellness and health promotion in healthcare. In public health nursing practice, it is abundantly clear that many factors beyond illness affect the health of individuals, communities, and populations. Studies show that there is no better way to promote health and improve the quality of life of individuals than basic healthy habits such as exercising regularly, maintaining a balanced and healthy diet, developing a positive and optimistic outlook, and refraining from smoking. Important goals are directing healthcare toward helping communities and populations identify their health potential and providing care and resources that move communities and populations toward their health potential. These actions serve to improve the health of the overall population and thus decrease the burden in vulnerable populations at the fringe of healthcare. Lifestyle improvement efforts have typically focused on the individual, but public health perspective sees that health behaviors are influenced beyond the individual. For instance, adolescents' decisions not to smoke are associated with their individual attributes like positive self-image, family characteristics like parent-child connectedness, aggregate characteristics such as peer influence, and community factors like living in a tobacco-growing region. As a result, interventions to initiate and maintain healthy behaviors have greater potential for success when they're directed systematically toward the multiple targets of the individual, the family group, the community, and the society. That is, when they use an ecological approach to community health promotion. This is just a model demonstrating for you the interaction of multiple determinants of health, and that's a word you'll hear more about as we continue on. The social determinants of health are defined as the circumstances in which people are born, grow up, live, work, and age, and the systems put in place to deal with illness. These circumstances are in turn shaped by a wider set of forces: economic, social policies, and politics. Farley and Cohen introduced the curve-shifting principle. This principle complements the ecological model and calls for targeting health interventions at the population level. They build upon representations of the relationship between individual and group behavior, with individual behavior being the foundation of the total population distribution. An integrative model for community health promotion developed by Lasprey and Colbeck helps nurses to see the continuity of care at multiple levels. It helps nurses describe their own areas of expertise within the complex healthcare system and provides a basis for collaboration and partnerships among nurses and other healthcare providers and the population. Important assumptions underlying this model include the need for integration of care in the complex healthcare system, the inseparable nature of individuals, families, aggregates, and community systems, and the maximization of health potential through health promotion interventions. In addition, the model builds upon complementary health and disease perspectives. The integrative model includes two major dimensions: the patient system and focus of care. The patient system is multidimensional, with nursing and healthcare targeting the multiple levels of patients. The focus of care in the integrative model includes health promotion, illness prevention, which includes disability or disease prevention, and illness care. Each focus is appropriate for some aspects of nursing and healthcare. It is even more important to remember that the goal of healthcare is a healthier community, achieved through health promotion interventions. No matter where care begins, it ultimately leads to health promotion of the community. The model depicts continuity and the expansiveness of the patient systems and focus of care. Health promotion is the central axis or the core of the model, and at its narrowest focus, individuals receive illness care. Now we will briefly talk about historical perspectives, definitions, and methods. By this time, you guys are relatively familiar with Florence Nightingale and the contribution that she made to public health. It holds a holistic view based on ancient Greek view of health, and Lalonde identified four major determinants of health: human biology, the environment, lifestyle, and healthcare. And then you guys are familiar with Healthy People 2020, which is the roadmap that the United States has for health in our country. This slide is just going to direct you to some places where you can get varied definitions of health and health promotion. Assessing health within health and illness frameworks requires that we look at illness prevention in several ways: risk appraisal, the guidelines for clinical preventive services, health risk appraisal instruments, and there are advantages and disadvantages to those that you guys can look at. And then there are wellness inventories, which we may use to assess someone's level of illness prevention. When we talk about community in the historical perspective, we need to understand that beginning in about the mid-1970s, there was an increased focus on community as the target of practice. There are a number of models and frameworks that guide community nursing. Despite the ideal that the concept of community as the client should be put into practice, often the individual in the community and the provision of care to that person overshadows the nursing practice and health promotion directed to the community. Because even nurses tend to place higher value on individual family interventions over community or system level interventions, it's really important that we expand education and outreach to nurses regarding their roles and responsibilities to ensure environmental health and community assessment and health improvement planning. In the systems perspective, humans are part of the hierarchy of natural systems, and health is a function of harmonious interrelationship among the levels of hierarchy. Movement in one level of the hierarchy has a corresponding movement in all the other levels. Thus, individual, family, aggregate, community, and society are levels of the system's hierarchy, and any change that occurs in one level has a corresponding change in another level. Anderson and McFarlane developed a model based on the assumption that assessing the various components of the system facilitates a healthy community. Their community as partner model includes 8 major community subsystems. The basic core of the community is its people, described by the demographics and their values, beliefs, culture, religion, laws, and other things. Within the community system, people interact with other subsystems. Salmon also developed a model focused on the public health mission of organized efforts to protect, promote, and restore health. It embraces the multiple determinants of health and is consistent with the Canadian framework of health. According to this model, nursing includes illness prevention, health protection, and health promotion strategies. Systems models provide important guidance for assessing community and indicate that system-level interventions require participation with the relevant subsystems. The strength of the systems model is that they can be used to guide assessments, but they can't be easily used to guide interventions. Keller proposed a population-based intervention model based on the scope of public health practice that crosses multiple levels of care. This model defines population-focused underpinning of public health practice and provides guidance for public health nursing interventions at the individual, community, and systems level. It was later termed the intervention wheel. It includes community, systems, and individual/family levels of practice. It is population-based and identifies 17 public health interventions. Similar to the integrated model of community health promotion, the intervention wheel delineates multiple levels of nursing interventions. The Los Angeles County Public Health Nursing Practice Model is built upon 5 assumptions, and those are on page 384 in your textbook for you. This practice model used nationally recognized components of the Public Health Nursing Standard of Practice, the 10 Essentials of Public Health Services, and the 10 Leading Indicators of Healthy People 2010, additional local indicators, and the intervention wheel. The social ecological model is another model used to guide nursing interventions. The social ecological model guides health promotion as well as illness prevention interventions. In this model, healthcare and health-related behavior are a function of individual, interpersonal, organizational, community, and population factors. As a result, interventions are specific to each of these levels. The Healthy Hawaii initiative was aimed at improving healthy nutrition and physical activity and reducing tobacco use. Interventions were developed for schools and community groups, and there were environmental and policy changes, health and physical education instruction for teachers, and education of the medical community as well as public education. The evaluation of this initiative led the developers to conclude that targeting various levels of the client system produced a synergistic effect that was greater than the sum of the individual levels. Two significant community studies of health risk, morbidity, and mortality are the Framingham Heart Study, initiated in 1949, and the Human Population Laboratories Longitudinal Survey in Alameda County, California, initiated in the early 1970s. In the Framingham Heart Study, 5,209 adults were followed over their lifespan to identify factors contributing to coronary heart disease. Periodic health assessments were done, and morbidity and mortality data were collected. Major risk factors associated with CHD mortality were identified in the original cohort. For example, elevated systolic blood pressure, elevated serum cholesterol, and cigarette smoking. The investigators proposed predictive models to relate the risk factors identified among well individuals in the Framingham population to the probability of cardiovascular disease. These complex predictive models have evolved over the years, and they've been widely used to document the multifactorial nature of cardiovascular disease and the interrelationship among major risk factors. The Framingham study is still in progress today, and those scientists are currently using new technologies to search for the molecular basis of disease and new cardiovascular risk factors. The Alameda County study was designed to measure the relationship of health and social behaviors to mortality in a community sample of 6,928 individuals over 4 years. The behaviors included eating 3 meals a day, eating breakfast, sleeping 7 to 8 hours a night, using alcohol moderately, exercising regularly, not smoking, maintaining a desirable weight-to-height ratio, and maintaining social networks. Smoking and excessive alcohol use were positively related to mortality. Physical exercise, 7 to 8 hours of sleep, optimal weight in relation to height, and social networks such as contact with friends and relatives, church and group membership were inversely related to mortality. These findings led to the current emphasis on social and environmental variables, and in addition to personal behaviors, illness prevention, and health promotion strategies. Findings from these early large-scale surveys prompted a number of public health multi-level intervention programs. The Stanford 5-City Project began in 1979 with a 6-year community health education program aimed at reducing cardiovascular risk factors. It was delivered through multiple channels. 2 treatment cities received low-cost, comprehensive programs based on social learning theory, communication theory, behavior change theory, community organization, and social marketing. The population of these treatment cities reported improvements in serum cholesterol, blood pressure measurements, smoking rates, resting heart rates immediately after the program, and sustained for 2 decades. Although cardiovascular and all-cause death rates stabilized or improved in the treatment cities, they leveled out or worsened in the comparison cities. Beginning on page 385 in your textbook, you can go and make some notes about the North Karelia Project, Pawtucket Heart Health Program, the Minnesota Heart Health Program, and the Dutch Heart Health Community Intervention. Two significant community studies of health risk, morbidity, and mortality are the Framingham Heart Study, initiated in 1949, and the Human Population Laboratories Longitudinal Survey in Alameda County, California, initiated in the early 1970s. In the Framingham Heart Study, 5,209 adults were followed over their lifespan to identify factors contributing to coronary heart disease. Periodic health assessments were done, and morbidity and mortality data were collected. Major risk factors associated with CHD mortality were identified in the original cohort. For example, elevated systolic blood pressure, elevated serum cholesterol, and cigarette smoking. The investigators proposed predictive models to relate the risk factors identified among well individuals in the Framingham population to the probability of cardiovascular disease. These complex predictive models have evolved over the years, and they've been widely used to document the multifactorial nature of cardiovascular disease and the interrelationship among major risk factors. The Framingham study is still in progress today, and those scientists are currently using new technologies to search for the molecular basis of disease and new cardiovascular risk factors. The Alameda County study was designed to measure the relationship of health and social behaviors to mortality in a community sample of 6,928 individuals over 4 years. The behaviors included eating 3 meals a day, eating breakfast, sleeping 7 to 8 hours a night, using alcohol moderately, exercising regularly, not smoking, maintaining a desirable weight-to-height ratio, and maintaining social networks. Smoking and excessive alcohol use were positively related to mortality. Physical exercise, 7 to 8 hours of sleep, optimal weight in relation to height, and social networks such as contact with friends and relatives, church and group membership were inversely related to mortality. These findings led to the current emphasis on social and environmental variables, and in addition to personal behaviors, illness prevention, and health promotion strategies. Findings from these early large-scale surveys prompted a number of public health multi-level intervention programs. The Stanford 5-City Project began in 1979 with a 6-year community health education program aimed at reducing cardiovascular risk factors. It was delivered through multiple channels. 2 treatment cities received low-cost, comprehensive programs based on social learning theories, communication theories, behavior change theories, community organization, and social marketing. The population of these treatment cities reported improvements in serum cholesterol, blood pressure measurements, smoking rates, resting heart rates immediately after the program, and sustained for 2 decades. Although cardiovascular and all-cause death rates stabilized or improved in the treatment cities, they leveled out or worsened in the comparison cities. Beginning on page 385 in your textbook, you can go and make some notes about the North Karelia Project, Pawtucket Heart Health Program, the Minnesota Heart Health Program, and the Dutch Heart Health Community Intervention. Interprofessional application to nursing and public health requires that we talk about community-based participatory research and photo voice methods and projects. Community-based participatory research provides the philosophical and theoretical basis for forming partnerships and collaboration within the community. It's been used to conduct ecological, community, and environmental assessments. Partnerships are active, and community members are involved in assessing, planning, implementing, and evaluating change. Some examples of community-based participatory research include the Community Health Advisor Program, the Cottage Community Care Pilot Project, healthy eating and exercising to reduce diabetes, and physical activity and neighborhood resources in high school girls study. You will find the details of those studies on page 387 in your textbook. Photo Voice is a method used in community-based participatory research projects that integrates the strengths of social support and engagement, building local capacity to identify and address community concerns. This process prevents written text from hindering communication and is effective in a society that uses oral tradition to preserve its culture. It can be used as an assessment tool. The last of these slides presents some examples of the integrative model to help you to apply these concepts. Illness care. At the individual level, the nurse assesses and monitors the mother's health, nutrition, and risk factors, and she teaches anticipatory guidance for child care. At the family level, the nurse assesses family dynamics, poor nutrition, access to care within the family, and refers the family members for care as needed. The nurse assesses for the presence of risk factors such as low socioeconomic status and unemployment. At the aggregate level, the nurse assesses the community for prevalence of infant mortality, teaches classes to raise awareness in the community about teen pregnancy prevention, or educates groups about culturally appropriate referral for family planning. At the community level, nurses work with key leaders and citizens to assess the prevalence of high-risk pregnancies and infant mortality in the community. The nurse may participate in designing community programs to enhance awareness and prevention of causes of infant mortality, such as SIDS and such as the lack for community members. In illness prevention at the individual level, the nurse teaches well-balanced nutrition and child care to the high-risk pregnant women or teens to promote healthy development and growth of the fetus and infant. At the family level, she teaches the high-risk family the importance of early and routine prenatal care and nutrition principles. The nurse helps the family to incorporate healthy foods into their diets and prevent nutrition-related problems. At the aggregate level, the nurse assesses the community for aggregates at risk for infant mortality, such as pregnant teens or minorities and poor women. She analyzes the health risk data and works with others to institute programs to reduce their risk, thereby preventing infant mortality. At the community level, multimedia education for teen pregnancy might be used, early prenatal care, or lobbying for legislation to promote resources for access to care and preventive services within the community. For health promotion at the individual level, the nurse helps the pregnant woman or teen adopt a healthy lifestyle as appropriate to age, culture, and her resources. At the family level, the nurse includes the entire family and plans how to adopt healthy lifestyle activities with the family. These might range from understanding balanced nutrition to planning relaxation activities for the family. At the aggregate level, the nurse educates high school personnel about evidence-based pregnancy prevention programs and resources for students. And then at the community level, the nurse participates with community leaders and citizens to establish education for teen pregnancy prevention and awareness of the need for early prenatal care for all pregnant women. And now these are just examples of how you might apply the model to infant mortality. It's not that you absolutely have to provide these specific things. Here's another example of where the model could be applied in obesity and the built environment. If you look at Table 17-2 on page 390 in your textbook, there's an example of a referral of a young woman recently diagnosed with obesity, and you can see the application of the model applied there.